that you said, we would add this to make AI work, and then describe to us where you're seeing that resistance and how we might overcome it.
Yeah, great question. So I'll start with just the resistance in general. And I always try to describe it as when any of us are trying these tools out, let's say we're using it for our daily health or whatever we're using at banking, it tends to be an individual decision. But when physicians have to do it, right, you're making a decision, for someone else in some degree. And so we tend to, in general, tend to be a little more risk averse because of it. We want to make sure that whatever is given to us is going to give us the right decision, right? And also, when you have all of these discussions about where is the data coming from, is it biased? Something that's definitely become much more obvious within healthcare and much more of a discussion point over the last decade, but we haven't really solved it, right? We're still trying to overcome that. And so now you're putting all of that data in there. And then, lastly, is that when we think about regulations, part of the fear is that if we are being forced to use it, how do we know where that data is actually coming from? And that might be this is going to be a problem probably not right this minute, but there have been rumblings about, are we going to be like, if maybe an example, so that if a doctor is going to see a patient and they don't use AI, let's say, and something happens, are they going to be liable for not using AI? But on the flip side, if they